Monoclonal antibodies have become a pivotal tool in the treatment of various diseases and in scientific research due to their unique ability to specifically target and bind to particular antigens. This specificity allows them to be used in targeted therapies, where they can identify and attack diseased cells without harming surrounding healthy tissue. One of the most significant applications of monoclonal antibodies is in the treatment of cancer. In cancer therapy, these antibodies can be engineered to recognize and attach to specific proteins found on the surface of cancer cells. Once bound, they can recruit other components of the immune system to destroy the cancer cells, deliver cytotoxic agents directly to them, or block signals that promote tumor growth. This targeted approach increases the effectiveness of treatment while minimizing side effects compared to traditional chemotherapy, which affects both cancerous and healthy cells. Monoclonal antibodies are also used to treat autoimmune diseases, where the immune system mistakenly attacks the body's own tissues. In conditions like rheumatoid arthritis and multiple sclerosis, monoclonal antibodies can be designed to bind to and neutralize specific immune cells or signaling molecules that contribute to the disease process. This helps to reduce inflammation and slow disease progression. Additionally, they are employed in the treatment of infectious diseases by neutralizing pathogens directly or by blocking their entry into host cells. Beyond therapeutic applications, monoclonal antibodies are invaluable in laboratory research. Their ability to bind to specific molecules makes them essential tools for identifying and isolating particular substances within complex biological samples. For instance, in diagnostic tests, monoclonal antibodies can detect the presence of proteins, hormones, or other biomarkers associated with certain diseases. They are used in various assays and imaging techniques to locate and quantify these substances, providing crucial information for research and clinical diagnostics. However, despite their many advantages, monoclonal antibodies do have some limitations and challenges. One significant problem is that they can sometimes cause adverse immune reactions. Since many monoclonal antibodies are derived from non-human sources, such as mice, the human immune system may recognize them as foreign and mount an immune response against them. This can reduce the effectiveness of the treatment and lead to side effects such as allergic reactions, fever, or chills. To mitigate this, researchers have developed humanized or fully human monoclonal antibodies, which are less likely to be rejected by the immune system. Another challenge is the cost and complexity of producing monoclonal antibodies. The process of creating these antibodies is labor-intensive and expensive, which can make the resulting therapies costly for patients and healthcare systems. Moreover, the production of monoclonal antibodies requires sophisticated facilities and strict quality control to ensure their purity and efficacy, further contributing to their high cost. Additionally, while monoclonal antibodies are highly specific, this specificity can be a double-edged sword. If a disease mutates or if the target antigen is not present in all patients or in all cells of a disease, the treatment may be less effective. This limitation necessitates ongoing research to identify new targets and develop antibodies that can address a broader range of diseases or patient populations. Despite these challenges, monoclonal antibodies represent a powerful tool in both medicine and research. Their continued development and refinement hold great promise for improving the diagnosis and treatment of a wide array of diseases, offering targeted and effective solutions that were previously unimaginable. As technology advances, the hope is that the issues associated with monoclonal antibodies, such as immune reactions and production costs, will be further mitigated, making these therapies more accessible to those in need.